So just because you're not feeling pain does not mean that everything is healthy.
Welcome to another episode of Michigan Family Wellness.
Here at Michigan Family Wellness, we believe chiropractic care and nutritional-based therapies are a foundational part of a healthy family lifestyle. No matter where you're at in the mitten, having a family is such an exciting time of life. So instead of feeling overwhelmed by stress, fatigue, and responsibilities with the kids, we invite you to become part of this empowering community to create happy, healthy families. By providing engaging interviews and practical applications, Dr. Wallner cultivates family health by equipping our listeners with the tools they need to elevate wellness in their own family. Dr. Wallner passionately serves the Michigan community at his chiropractic and nutrition-based practice, where he specializes in pregnancy, pediatrics, and family wellness care. And now, here's your host, Dr. Kyle Wallner.
Good day, Michigan families, and welcome to another empowering episode of Michigan Family Wellness. I am your host, Dr. Kyle, and on today's episode, Dr. Piiamarie Bowers lays down incredibly valuable content for you and your family, specifically as it applies to dentistry, taking good care of your teeth, and making sure the kiddos practice good dental care as well. I want to take a moment to thank everyone who attended our engaging live event last Saturday, where we discussed the benefits of chiropractic care for pregnancy and pediatrics. If you weren't able to attend the live event, head on over to my YouTube channel by searching Dr. Kyle Wallner. Once you're there, look for the video recording of the presentation. In fact, I'll just drop a link into the show notes for you here. And you'll find yourself fully equipped with all of those practical applications for nourishing a natural birth by balancing the pelvis, sacrum, and lumbar spine. Well, as I mentioned earlier, we have a ton of value to bring you today, but before we jump into the interview, I want to announce an exciting event we're doing over at Power Performance Gym. The Women's Health Expo will be held on August 3rd, so right around the corner. This will be a panel discussion by several different experts in their field and how their expertise is able to elevate women's health and provide resiliency and restoration to the valuable women in our community. More details are coming soon, and if you want to stay up to date on all the happenings here at Michigan Family Wellness, the best way to do that is to visit MichiganFamilyWellness.com and subscribe to the weekly informative newsletter. All right, families, let's jump into the interview. And welcome to the interview portion of today's podcast, where we have Dr. Bowers. Dr. Bowers grew up in Michigan's Upper Peninsula. After graduating from Albion College, she earned her DDS degree from the University of Michigan. She's been in private practice for over 10 years and has made Southeast Michigan her home. In her free time, she provides volunteer dental care in Detroit, as well as on international dental mission trips. Dr. Bowers loves spending time with and getting to know her patients. Caring for them and developing lasting, trusting relationships is what she enjoys most about being a dentist. For Dr. Bowers, conversation is the key to a healthy doctor-patient relationship. For Dr. Bowers, great dental care and general wellness are very much intertwined. Dr. Bowers, it's wonderful to have you on the podcast today. Welcome.
Hey, thanks. This is a fun idea. Great to be part of what you're doing.
You know, there's so many firsts about this podcast. I don't think we've had, I think actually we have had someone who's from the UP of Michigan there. And I know that we haven't had a dentist on the podcast yet. So this is really exciting.
Oh, that's awesome. Good.
Great. So, Dr. Bowers, I know we just learned a little bit about you as the professional. Can you tell us a little bit more about Dr. Bowers as the person?
Well, sure. I am single myself, but recently got a puppy dog, a little long-haired dachshund. His name is Uno, and I have the great luxury of bringing him to work with me every day. So he comes to the office, and he's there all day, and it's amazing the interaction that patients have with him, how he's so calming for patients, even the adults and even the grown men. We've had men in their work suits on their hands and knees on the floor playing with the dog, and you can see it just, their shoulders drop and people relax. It's just such a joy to be a witness of that, of how the animals make such a difference at work. So that's fun to see. What we do. Yeah.
Absolutely, Doc. You know, you bring up such a great point. Stress reduction is a huge part of my chiropractic and nutrition practice. And I agree with what you're saying. Essentially, especially for, using an animal, a companion in that way, just to help lower cortisol levels, just to lower stress in general. It's so great. I think what you're doing there is a fantastic way to elevate family wellness over there at the dental office. Yeah, so you're from the Upper Peninsula. Do you have a favorite part of Michigan?
I grew up in Marquette, so the north side of the Upper Peninsula, along the shores of Lake Superior. And for me, the beauty of the rawness of the big lake is just amazing. I think people either love mountains or they love water or different things, but for me, it's just that rawness of the nature, where you can really see the power of the water, but yet the peace and calm of the water, kind of all in the same scene. But that's what I grew up with, so that's what I'm accustomed to, and it feels like home when I can see that.
Gosh, you're just making me get the chills here. That's such a beautiful picture you just painted, and I kind of wish I was just there right now.
Wouldn't it be nice, right?
Yeah. So, Dr. Bowers, we've heard about your professional dental practice over there in Dexter. A central tenet here of Michigan Family Wellness is, the value and benefits that we can provide our listenership with. So let's set up a framework. Let's say, I'm a single parent. Maybe I have some kids at home. Maybe I have a stressful job. And, I've been neglecting taking care of my dental care. What would you say would be the value and the benefit of, getting those 6-month checkups, or, constantly, is flossing really necessary? Do I really have to brush my teeth? Go ahead and just kind of tell us all about that.
Yeah, those are absolutely valid questions. Teeth, I think people forget that teeth are alive. If teeth are not hurting you, they're not something you necessarily think about, except perhaps from an aesthetic standpoint. Are they stained? Did I drink too much coffee today? Does my breath smell? Mm-hmm. But it's important to remember that teeth are alive. There are blood vessels coming through your teeth, and getting a filling on a tooth sounds like a quick and easy solution to things, but it's not. Once you alter the tooth, there's consequences to that. It's never the same again. It's never as strong again. But the key to remember is that decay, or a cavity, or actually what it is the tooth is starting to rot, that is preventable. However, there's no magic pill or magic bullet for me to give you that would stop it. For those of your listeners who are familiar with Weston Price, his stereotypical clean eating diet, a diet rich in minerals and vitamins and the good healthy fats, those are things that really maintain the strength and durability of your teeth in those times when you're not able to brush, or in those times where you have birthday parties, or you're in a rush and you have to get Little Caesar's pizza or something like that. There are times where, real life happens and we can't all eat perfectly. But if we can maintain health within our teeth, those moments aren't so damaging to our teeth. Processed foods equal processed teeth, and those teeth just aren't as strong.
Absolutely. I just love the way, Dr. Bowers, that you just get right in there and you go straight for the value. You're a straight shooter, in my opinion. There's a lot that you mentioned there, so I kind of want to circle back and unpack a little bit of it. First of all, you mentioned, in terms of prevention, and I tell this to my patients too at my office. People ask me, when should I get checked for chiropractic care? Do I really need to come in? When's a good time to do it? I'm not really in any pain right now. And I always tell them, hey, the sooner you can get checked, the better, as soon as possible. Because just like you're saying, the longer you wait to address those spinal subluxations or that dental cavity, the harder it is to intervene and to actually fix those things. You also mentioned Weston A. Price and nutrition. And gosh, again, there's just so much overlap here. Your spine, your nervous system, all of that is going to function so much better. Your adjustments are going to hold when you're able to eat clean food, real food. Right. You mentioned the processed foods, the industrial global diet, there's McDonald's all over the world now. And now we're starting to see some of these diseases, not just here in America, but globally. So I really appreciate, appreciate everything that you're laying down here. And I can tell that your patients really appreciate it as well. And I bet that you see the results, in your patients, in your practice. They're experiencing, the highest quality dental care, and they're just able to contribute more to the world around them and to their families.
Well, that's just it. The more I can prevent, it makes for a better citizen in the world. Dental problems are the number one chronic childhood illness, the number one. Mm-hmm. And what a simple thing, theoretically, to prevent and to maintain dental health. Children miss school, then the single parent, like you had brought up, misses work, and then they're not getting paid, or quality of life in the elderly because they're missing so many teeth. Well, now they can't eat to digest their food. It is a big deal. And if we can start to educate people as soon as possible, and, at my practice, we educate children because parents don't always know everything either. And so we have what we call a hands-on health lab where we start right away from the little children to the teenagers, and we do health experiments. We talk about sugar. We show them what amounts of sugar are. We talk about acid and things that happen to teeth. We talk about diet. We look at what's the difference between eating an apple and having a Monster drink. Because children want to know information. They're craving information, and they want to make right decisions. So it feels good to be part of that with parents, educating people so that they can keep going to work and keep the world turning, right?
Absolutely, Dr. Bowers. And, one of the things I hear my patients say a lot is, but doc, I got to have my coffee, I guess, yeah. And, exactly to your point, chronic use of, these sugary drinks, these caffeine, I tell people, look, I drink coffee too, but if you can adopt a lifestyle of moderation, or if you can even reach for that, cleaner, organic, non-GMO food, that's always going to work in your favor. Would you agree with that?
Absolutely. Absolutely. Again, real life happens. We all have birthday parties. We have celebrations to go to. Or for heaven's sakes, you're just exhausted and you grab the quickest thing you can. Yeah, those things happen. But in the regular routine of life, if you can maintain those healthy choices, it impacts everything. It impacts, like you were saying, from your avenue of healthcare to my avenue of healthcare, to a physician. It all is the same human body, and those same cells are flowing through the whole body. The tooth has nerves. The spine has nerves. They're all there. They all need to be maintained.
Dr. Bowers, it's almost like you're reading my mind right now, because that's a perfect segue into my next question for you. Sure. Now, again, I'm not a dentist, so correct me if I'm wrong, but this is what I've been told. Okay, let me know if this is right. Okay. The teeth, like the tissue, the gum line or the dental tissue of the teeth itself, you mentioned, like cells of the human body. It's unique in the sense that many of our other tissues will regenerate or turn over, like our body makes new ones. Yes. But is it correct to say that there's something unique about the tissues of the teeth, or maybe our gum lines? Which one of those actually doesn't regenerate?
Well, there's a little bit of both. Yes, we do know that bone can regenerate, but once we've lost bone in the jaw, for some reason that bone doesn't come back at the same rate. For example, if you break an arm, things are going to heal and it's going to go back together. And the jawbone does come back together, but it doesn't lift up. So when you see people have receding gums, or you hear about periodontal disease or gum disease and people get loose teeth, that bone right around the tooth does not grow back around the tooth.
Gotcha.
Secondarily, tooth structure itself, once somebody has a cavity that has already started to fully destroy a tooth, like actually make a hole, an actual cavity, a space where there's broken down tooth structure, that tooth structure no longer grows back. It can harden over. Mm-hmm. It can kind of heal itself, but it doesn't actually rebuild into a brand new solid tooth.
So again, to your earlier point, the more you take care of your teeth, especially starting from a young age, the greater chance of success and significance that you're, not going to be as likely to have, the problems or the issues that we're talking about here with, these turnover of the, dental tissue.
Correct.
So, Dr. Bowers, you have this fantastic dental practice out in Dexter, Michigan. Can you give our listenership just a few practical applications and just kind of lay out some of the benefits that you would recommend or some of the strategies, some of the techniques that you might recommend in terms of, maintaining proper dental health?
Yeah, for sure. Health is definitely something that we can all maintain at home. Whether it's your whole body, physical health, or even just your mouth, you can maintain that at home. But that's not to take away the value of seeing a dentist or a hygienist, part of that team that's evaluating things that you just can't see for yourself. So making the assumption that your mouth is healthy, and that does not mean only pain-free. So just because you're not feeling pain does not mean that everything is healthy. But again, going back to assuming that there is health, rinsing your mouth with some salt water after your meals. You don't have to brush right away. And frankly, we don't like people to brush their teeth right after eating because the mouth is acidic. And so the teeth actually soften in there for a few minutes. So we don't want you brushing the softened teeth. So rinsing with warm water that has a bit of mineral-rich salts in it helps a lot. Scraping your tongue, getting the bacteria off your tongue, that bacteria that's traveling, from the sinuses down, and sometimes bacteria comes up, but cleaning the surface of the tongue, getting rid of some of that bacteria, that makes a difference. The other thing that's interesting is we like our patients to brush their gums. So not just their teeth, but the gums also. But when we have you brush your gums, we need you to be calm and relaxed, not in a hurry. If you're already late for work, then don't brush your gums because I don't want you scraping them away and causing damage to that tender tissue that's there. The other thing is flossing. Sounds so simple, right? But 35% of your tooth cannot be reached by a toothbrush bristle. So to get the floss down in between the teeth and actually scrubbing that side of the tooth with that string makes a big difference. It just removes a lot of bacteria that hides in those tricky little spots.
You're mentioning so many great practical applications here, Dr. Bowers. If I could just circle back to, you mentioned the bacteria on the tongue. And, I talk to my patients a lot about the microbiome in the gut, or basically the good bugs that we have in the gut, and how that can be, a little imbalanced at sometimes, some dysbiosis or some leaky gut, bloating, things like that. Do you see a lot of, I'm not sure how you would measure this maybe in the mouth with the oral microbiome, but I'm sure you can tell, if someone's got, bad bacteria overgrowth, or possibly what I see some people doing sometimes is they'll use like Listerine all the time. They're always washing and flushing and just draining their whole mouth, or perhaps a lot of oil pulling and just maybe overdoing it. Do you see anything like that in your office?
Absolutely. The oil pulling is something we all see on Facebook, on internet, all over the place. Oil pulling is great, but if you already have a healthy balance of bacteria, it's not really necessary. We want to maintain that balance. And so to really start doing aggressive things like a Listerine, for heaven's sakes, day after day, no, that isn't a wise idea. There is that healthy moment of bacterial balance in the mouth. And that's just it. There's no pain or discomfort when you get out of whack. So you don't know that, hey, I have increased inflammation in my mouth. Now bacteria is getting into my bloodstream because I flossed too hard and cut my gums. And that little sliver of a moment is enough to bring some of that bad bacteria into your body.
Yeah, and you talked about flossing there too. I think it was a major breakthrough for me because I was just, pushing the floss up between the teeth and just kind of pulling it back down. And I was like, okay, great. That's one side is done or whatever. But you actually mentioned, no, actually take the floss, go up one side of the tooth, do some scraping and then, go on the other side, at least for some teeth, and actually get on the tooth and not aggressively, like we've been saying, don't overdo it, but actually, get some movement in that bacteria. And, here's a question I get a lot too. Should I brush then floss, or should I floss and then brush, or is there a difference? Does it matter?
I really don't think there's a difference. As long as you do both, I'm good with that.
Absolutely. Well, Dr. Bowers, I am so happy with the value and the benefits and the practical applications that you've been laying down here today. Just real quick for our listenership, do you have any resources? Do you have any, things that inspire you to continue serving families in this way? Or do you have any, like books or things that you're reading in terms of resources for our listeners?
Resources for the listeners. A lot of, there is just so much information that when you're able to follow online a blog or a doctor or just an educational page that is something that's trusted, those are really great resources. Dental health isn't rocket science. All you need is a toothbrush, and frankly, you could just use a stick. So it's not something where there needs to be a whole lot of deep scientific information to take care of yourself. People have some controversies with mainstream medical care and alternative medical care, and that's where the decision needs to be made for each individual family, what route to follow. And so that, I think, kind of guides the research that people do online. So no, I don't have a specific website where I can necessarily send people, because people have different value systems with what they're looking for.
One of the things that I'm picking up from what you're saying is actually a quote that I like to keep in the back of my mind, which basically goes like this: success is neither magical nor mysterious. Success is the natural consequence of consistently applying the basic fundamentals. So what I hear you saying, in the context of dentistry is, just do the basic fundamentals. Brush, floss, get your 6-month checkup, start early, don't wait, eat clean, eat real food, and you're not going to have any problems because, this has been around for a while.
Exactly.
Fantastic.
Exactly. Good
well,
quote.
Dr. Bowers, where can people learn more about you?
I have, like you said, a practice in Dexter, Michigan, and the website is dexterdental.com. And there we have our office phone number and our map location, email, contacts, that kind of stuff. It's all right there.
Fantastic. And definitely I encourage everyone to go to dexterdental.com to learn more about Dr. Bowers. If you're resonating with her message, if you're looking for, a dentist, or perhaps to just get your whole family taken care of, I highly endorse the work that Dr. Bowers is doing out there in Dexter. And remember, we'll have a dedicated webpage with all of the show notes that we've mentioned here at MichiganFamilyWellness.com. Also, you can expand those show notes on your mobile device if you're listening, and you can take advantage of those clickable links right now. Dr. Bowers, thank you so much for coming on the podcast.
Oh, this has been my pleasure. Thank you.
And remember, we can do far more together than we could ever do apart. coming to you from beautiful Southeast Michigan. I'm your host, Dr. Kyle, and this is Michigan Family Wellness.
Now that you've been equipped with the latest in family wellness solutions, we want to encourage you to apply these strategies right away. But the thing is, there's still so much to learn. Connect with Dr. Wallner's Chiropractic and Nutrition Office by going to MichiganFamilyWellness.com and click the newsletter sign-up button to join the informative and supportive community of chiropractic wellness. You will also receive as a gift from Dr. Wallner a copy of Michigan Family Wellness Solutions, an invaluable resource containing dynamic tools to elevate family health and vitality. Michigan Family Wellness wants to thank you for being part of today's podcast. Please subscribe to our podcast on iTunes and give us a 5-star rating and review.